if you have kids, you're gonna wanna stay to the end of this. I'm in line, getting ready to pick up my kids from school, and I wanted to talk about exposure therapy, especially when it comes to kids. A lot of times we want to cradle, we want to make sure they're not gonna go through any kind of hurt or pain and keep them away of certain things that are actually going to help their growth. In the clinical world, exposure therapy is if you have a fear of something, you simply expose them to that fear, typically in a controlled setting. An example is if you're afraid of elevators or airplanes, you would go onto an elevator with somebody, some kind of support system, and go up and down the elevator until you feel comfortable. Same thing with a plane. If you want to heighten the effect and kind of increase anxiety, you could give somebody caffeine, and that can help elevate their anxiety, which helps simulate more of that anxious response that you have when doing something you're afraid of. Now, with kids, it's very important to kind of let go of the reins a little bit and let them experience things on their own and feel all the emotions, feel the fear, the anxiety, the anxiousness that comes with certain things, because that's going to help build their level of resilience and allow them to process things in their own way. I'm not saying you can't support them and be there for them, but by taking away experiences, you're going to end up hurting your kids, because once they get those experiences later on in life, and they will get them, they're not going to know how to react. So by giving them in a controlled setting, it won't be the first time they see those experiences, and they're better off to make a good decision when it actually happens to them. Let me know if you have questions, have any comments. Love to hear your thoughts.